This video will talk about sebaceous cyst. So basically the sebaceous glands which are present adjacent to the hair follicles will get blocked and it will lead to the collection of sebum, right? So this all sebum is getting collected in the dermis. So this is called as sebaceous cyst. So this area which you can see is called as summit of this sebaceous cyst, and through which you can see one black colored dot which is called as punctum of the sebaceous cyst. So in this picture you can see this whole thing is a sebaceous cyst and this black dot is a punctum of the sebaceous cyst. So sebaceous cyst, it is a cystic swelling which contains fat, epithelium and the sebum, which is of yellowish and the whitish cheesy material. So it occurs in the dermis, we have seen in the picture. So it secretes sebum, and the cyst is formed because of the blockage of the duct in the sebaceous gland. Because of the blockage of sebaceous gland, it will lead to collection of the sebum. It is seen in the dermis and it is called as sebaceous cyst, right? So it is basically painless swelling which is mobile and fluctuant, and also punctum can be seen. I have shown you in the picture, and it is non-trans-illuminating. That means the light is not transmitted to the swelling. Why? Because the content is sebum, fat and all, right? And the skin is adherent over the summit. So if the sebaceous cyst is involving the mucosa of the lips or the oral cavity, it is known as Fordyce disease. And the punctum, what do you mean by punctum? Punctum is basically depressed black colored spot which is seen over the summit of the sebaceous cyst. I have shown you in the picture. So the black color is because of the denuded squamous epithelium, right? Coming to the complications, it is important to remember every complication. The first one is Koch's peculiar tumor. Basically the ulcerated, painful, fungating mass and also associated with the discharge. And sebaceous horn, it is seen because of the hardening of the discharge sebum, right? So this all the discharge sebum will get hardened and forms this horn-like structure. It is known as sebaceous horn. And also infection and abscess can be seen. And in the Gardner's syndrome, you can see multiple sebaceous cysts. And in the scrotum, usually multiple sebaceous cysts can be found on the scrotum. It is also known as strawberry scrotum. So what is the treatment of it? You have to remove the scrotum, right? And the treatment of the sebaceous cyst is basically excision, which you give adjacent to the punctum. Suppose this is a sebaceous cyst and this is the punctum. You give incision adjacent to the punctum. It is known as elliptical incision, right? So we have to give this incision and also avulsion of the cyst wall. If there is any capsule, first we have to remove the capsule. If not, recurrence will be seen, right? What if there is any abscess in the sebaceous cyst? So first we have to drain this abscess and then you have to give this elliptical incision, right? So this is about the treatment of sebaceous cyst.